Assalamualaikum warahmatullahi wabarakatuh. Welcome, distinguished panelists and audiences, and good morning from Jakarta. Welcome to the webinar, Mainstreaming the Use of Publicly Available Data in Strengthening Public Health Resilience in Indonesia. This webinar is organized by Center for Strategic and International Studies, Indonesia. Allow me to introduce myself. My name is Noudhy Valdryno, your host for today's event. Please allow me to warmly greet a number of notable actors for today: Dr. Yose Rizal Damuri, Executive Director of CSIS Indonesia, Bapak Setiaji, Chief of Digital Transformation Office, Ministry of Health Indonesia, who will be giving opening remarks for today's webinar. We'd also like to extend our greetings to our honorable attendants for today, and I would also like to extend greetings to our moderator, Pak Fuad, from the Faculty of Medicine, Public Health and Nursing at Univesitas Gadjah Mada, and also our panelists for today, Bapak Noory Okthariza, researcher at the Department of Politics and Social Change, CSIS Indonesia, Bapak Noudhy Valdryno, Public Policy Manager at Mada, Bapak Juan Kanggrawan, Head of Data Analytics and Digital Products from Jakarta Smart City, and Mbak Dyana C, Jatnika, Head of Implementation, Jabar Digital Service. We are eager to listen to your insights about the use of publicly available data from your extensive experience. Last but not least, we would also like to welcome all distinguished audiences joining today's agenda. First, let me briefly explain today's agenda. We will listen to opening remarks by Dr. Yose Rizal Damuri and Setiaji, Bapak Setiaji, followed by a panel and discussion session moderated by Bapak Fuad. During the discussion session, we would like to remind participants that you may deliver questions or comments through the Zoom chat room or also through YouTube columns. Without further ado, we would next like to invite Dr. Yose Rizal Damuri as the Executive Director of CSIS Indonesia to give his opening remarks. The screen is yours.
Thank you, Nadia. A very good afternoon to all of you and welcome to CSIS webinar that today they take the theme of mainstreaming the use of publicly available data in strengthening public health resilience in Indonesia. Special welcome to Bapak Setiaji from Ministry of Health, Republic of Indonesia. Also Pak Fuad from University of Gadjah Mada. And also to all the speakers, Pak Noudhy Valdryno from Mada, Pak Juan Kanggrawan from Jakarta Smart City, Ibu Dyana Jatnika from Jabar Digital Service, and also to my colleague Noory Okthariza. I think this seminar would discuss about a very important issue that we've learned so far during the last 2 years of the pandemic. This pandemic actually told us a lot about the importance of data. Not only data that are collected regularly by the government agencies or by certain agencies in regular periods like 3 months or 1 year, but also the importance of high frequency data. How this high frequency data actually can provide us more informations, up-to-date informations on what happens or what are the developments that happens recently. And during the pandemic, we really need that kind of informations so that we can try to contain or to respond with an appropriate policy and measures. That high frequency data is actually so far have been available for quite a while. Like for example, CSIS already have a good collaborations with Mada in order to use several high frequency data. There are actually also publicly available. with that actually try to capture the response or the actions of the Facebook and Meta users, and that kind of data actually also already provide us with a lot of informations that we manage to analyze and then try to provide recommendations in order to respond to the recent pandemic that we have. There are also many other data, actually, this high frequency data that are publicly available that we still can use. But the thing is, of course, it's not easy to use that kind of data, that high frequency data, because we're dealing with not only thousands of data points, not only dealing with tens of thousands of data points, but rather having perhaps billions of data points that we need to analyze, and we need to get meaningful informations of it. So the ability or the capacity of human that can the personals that can analyze this data is also quite important. So that in CSIS we still try to develop the capacity in analyzing all this kind of high frequency and publicly available data. But I believe with this seminar we also can get more information, especially on what the governments already had done in order to tap the benefit from the availability of this data, or perhaps even the government also already start to collect this kind of data and use it for the benefits of the public. One thing that I like to raise also, perhaps it can also be discussed in this webinar, in this discussion, is that the availability, the importance of respecting the data privacy. I know this doesn't appear in the terms of reference in the organizers already prepare, but it seems to be quite a stretch from the current discussions of the benefits of this available public data. But I believe this is a very important aspect, that we also need to respect the data privacy, because otherwise not only that it would be important for security and also for the confidence of the users and those who are the data have been collected, but it's also we also need to comply with the globally accepted standards on data privacy, because if we cannot comply to that standard, international standard, Indonesia would have difficulties in actually dealing with that kind of data exchange that would perhaps make Indonesia miss the opportunity in dealing with certain issues. With that point, I would like to end my opening remarks, and I wish you a very productive discussion, and hopefully we can come up with useful recommendation as well. Thank you.
Thank you, Dr. Yose, for your very insightful opening remarks. Hopefully we can also discuss this during the webinar later on. Next, we would like to move on to the next opening remark from Bapak Setiaji from DTO of Kemenkes, or Ministry of Health Indonesia. The screen is yours, Pak.
Okay, thank you, Mbak Nadia. Good morning, ladies and gentlemen, participants of the webinar. Yeah, thank you for CSIS, especially for Mr. Yose, Pak Yose, and etc. I think we have many people in these webinars, yeah, many speakers already known each others. Thank you for CSIS for having me today to give opening remarks for today's webinar. Ladies and gentlemen, as we know, Indonesia has more than 270 million people. This is a huge numbers. People spread across an archipelago of over 17,000 islands that faces a range of challenges in healthcare delivery and access. We have learned how the COVID-19, especially in the 2 years before, we have some learns. Not only how we can manage our health capacity, and also how we manage the data and etc. Alhamdulillah, the COVID-19 situations now going more better, especially after the mudik Lebaran. The number of cases of COVID-19 still manageable. Now is under 400. Indonesia actually produce big health data every day. Thousands of medical record data, drugs, logistic data, patient prescriptions are produced every day, which if accumulated can be petabytes in size. This data is spread for every health stakeholder, such as health facilities. We already registered is around 60,000 health facilities, including not only hospital, but also lab, apothec, clinic, and etc. However, not all data is integrated and recorded digitally. This causes policies not yet based on data and inefficient services. Talking about data, Indonesia's data is scattered across multiple platforms. Data spread across not only multiple platforms, but also multiple systems. There is diversity of data formats and types, as well as lots of volumes of data. Moreover, currently most health data is still aggregated and not real-time and inconsistent. We would like to adopt a user-centric interpretation to overcome these challenges and get ready to face the implementation of big data analysis in order to produce actionable insight for decision makers. In implementing every policy related to the handling of the COVID-19 pandemics, the government conducts various database analysis from the integrated technology ecosystem. We have used an integrated COVID-19 big data system to monitor the COVID-19 situations at the city or district until provincial level. The data is open to the public in order to realize accountable data transparency. Some examples of database COVID-19 pandemic handling policies that have been done are the COVID-19 situation assessment data. This data is used to reference by the government in setting policies to enforce restriction on community activities, or maybe we can call PPKM. This data is available from district, city to provincial levels. The data itself is content about the vaccination data used as a basis for making decisions regarding vaccine distribution, vaccine stock, and etc. And also we provide the comorbid data in Peduli Lindungi applications is used as a determinant of a positive patient to be recommended to be isoman, isoter, or referred to health facilities. And also we provide like hospital oxygen availability as a reference for distribution of oxygen to the hospital. And also hospital bed availability, provide information for patients regarding the availability of bed in hospital in real time. With the efforts that have been pushed by the Ministry of Health of Indonesia, we understand the importance of strengthening coordination among all stakeholders by involving all parties in handling the COVID-19 pandemics and public health resilience. That the utilizations of technology to handle the COVID-19 pandemic, such as strengthening the use of Peduli Lindungi as a single platform for health protocols, utilizing biotechnology, big data analysis, AI, machine learning, and so on, can ease the process of handling pandemics. In order to support national health development, the MOH carries out digital health transformation that starts early in human life in order to increase preventive efforts in order to realize a digital transformation of better health based on caring values. We launched the Digital Transformation Strategy 2024 last year to answer the problems, potential, and challenges of Indonesia digital transformation so that it can provide comprehensive, implementable, and measurable solutions in developing sustainable health services. Yeah, we already have developed a digital transformation strategy that focuses not only on health ecosystem, but also service efficiency. And the important thing is the data integration for data-driven policies, including the development of health biotechnology. Yeah, this is the future's technology in the health and innovation ecosystem within them. Yeah, we have a vision that a strong digital health system can enable efficient and equitable access to health service throughout Indonesia. Currently, the Ministry of Health is also developing what we call the Indonesia Health Services IHS platform. Actually, this is a platform to integrate the health facility, can connectivity, analysis, and data services to support and integrated various digital health services in Indonesia. Indonesia Health Services is expected to be a connecting platform between various applications in the various health industry players, so that the process of digitizing health services is easier and the governance of existing health application is more efficient, standardized, and integrated. The availability of various technology today can be a strategic asset in realizing digital transformation in the health sector, especially in dealing with various health problems in Indonesia. For example, using a big data, AI, IoT, and machine learning. The recorded data will be collected in health big data managed by DMOS. The application of artificial intelligence and health big data will encourage more precise, personalized, and up-to-date health services based on historical data analysis of patient medical record. So with this transformation, we hope Indonesia services, especially for the health services, can be more better and make the Indonesia more healthy. Thank you.
Thank you, Pak Setiaji, for your opening remarks. May this webinar act as a platform to further discuss about the challenges that we are still facing so that we can mainstream the use of publicly available data. Moving on to our main event for today, I would like to pass the floor on to Pak Anis, who is going to be the moderator for today's session. Pak Anis, you may have the floor.
Okay, thank you, Mbak Nadia. Can you hear me clearly, Mbak Nadia?
Yes, we can hear you very clearly.
Yes. First of all, thank you very much for CSIS to ask me to moderate this very important session. I think we have already learned and listened from the keynote speech, either from Pak Yose and also Pak Setiaji, the very important data, especially after the pandemic situations. And eventually, in the pandemic, we also learned that many data are currently available, either from provider, as we know that among the big Indonesian population, with the 4th most populous country in the world, many of our population, netizens, are using social media. And Pak Yose already mentioned that billion numbers of data points are currently available. And also Pak Setiaji mentioned that the government already started to adopt digitalization, either at the national level and also at the subnational level. During this session, we will invite 4 speakers. One will be from the technology provider from Meta. They will share with us insight regarding the publicly available data from Meta. And also another 2 speakers from the provincial government offices that very active on implementing digital services for public, which is from Jawa Barat and also Jakarta. And also we will invite a speaker from CSIS who is experienced on using the publicly available data to support policy, to gain insight from the data and also to provide evaluation, and finally for recommending any policies, especially during the pandemic situation. So in the next 2 hours, we will discuss these topics, and we will start firstly by Mas Noudhy Valdryno, the Public Policy Manager from Meta. Mas Noudhy, I think it is time for yours to share your insight regarding how Meta provide this publicly available data, how the use of this data, and any other insight regarding the challenges on using this data. Please, Mas Noudhy.
Thank you, Pak Anies. A very good morning to everyone, Pak Yose and Pak Setiaji from CSIS and Kemenkes. Thank you for inviting us to this event, and thank you for keeping on supporting us in championing the use of publicly available data sets in Indonesia for better policies, particularly in health sector. So first of all, I want to say greetings from Kuala Lumpur. I'm currently traveling, but happy to be here. And Assalamualaikum warahmatullahi wabarakatuh to everyone. Salam sejahtera to all the audiences. Hope you are all well. My name is Noudhy Valdryno. People usually call me Rino. I'm currently Public Policy Manager for Meta in Indonesia and few other markets in Asia Pacific, and currently responsible for our Data for Good initiative in Indonesia. So in today's session, I think with the timing provided by CSIS, I'd just like to share short or a quick brief on what is our Data for Good program that CSIS friends and also Kemenkes and Jakarta Smart City have been collaborating with us for the past few months and years. What is the program? What does the initiative looks like, and how can more of us and more important stakeholders in Indonesia utilize this program? So without further ado, I'll just share my screen first. Okay, I hope everyone can see the full screen, and hopefully the PowerPoint sharing goes smoothly. But again, I'll just skip this. This is my short profile, and for those who want to connect directly, feel free to do so. Before I go to Data for Good, a lot of people actually ask us on why Facebook changed to Meta, and basically this is a new vision of the company. We still focus on 4 of our biggest social media applications. So most of you here will probably know Facebook, Instagram, Messenger, and WhatsApp. Those are still the main, the core businesses of Meta platforms. But now we have, I guess, a better structure because the company is named, it has a new name. So it shows the vision for the longer term, which is, as most of you have heard, it's about building for the metaverse period, right? So that's for another topic. But as of today, we're still focusing on the 4 of our biggest social media applications, and this is why we can, especially from Facebook Blue, which is our most senior application. This is where the Data for Good program derives from, right? So basically, Data for Good program, and sorry, the slide is in Bahasa Indonesia, is a program from our global team to help relevant stakeholders and communities create a more accurate policies using data from Facebook app. So when I say Facebook app, it is very specific because a lot of people ask us on whether we use Instagram app or WhatsApp data. We don't. We use only Facebook app. And this is very, very useful for a lot of people because, as you know, Facebook is being used by almost 3 billion people around the world. and it's easier for us to generate much more samples of data through the Facebook app, right? And this is why a lot of the data for good product or data for good data sets are quite relevant for our partners and stakeholders. And we believe that these data sets can be impactful to help, especially in the health sector and the economic sector as well. And there are three principles of data for good. So firstly, we always collaborate with partners. And I can't thank CSIS enough for being one of our most active partners in Indonesia and using the data sets, but also translating the data sets into a more consumable collaterals, right? Like reports and even events and explaining to Indonesian audiences. And I'll have examples later. And then the second one is a data set that is open as much as possible, accessible for the public to be used. Of course, this doesn't apply to all data sets. So our academic partners like CSIS and University of Indonesia, University of Gadjah Mada, of course, they have specific access to certain data sets, but we want to make as many data sets available for public as we can, right? Which relates to the second, the third principle that we have to do, and it's imperative for us to do, which is to protect our data sets with a good and solid privacy protection mechanism, right? So this is a very, very important principle, because we will be sharing a lot of data with academic institutions, and hence we need a very strong privacy protection mechanism. So these are some of our partners in Indonesia, and we are open to collaborating with more partners. CSIS have been our longest partner on the ground, and again, thank you. We collaborated with Univesitas Indonesia, we collaborated with Universitas Gadjah Mada, UNICEF, PostLab, and all these organizations use our data sets really differently from each other, right? And as we know, CSIS, you are working closely with a lot of government leaders, right? And is able to advise a lot of relevant stakeholders through your analysis, right? PostLab is more into digging deep about these data sets and how to really use it in a very technical level, especially in long-term policy formulation with all their partners, right? And of course, University of Indonesia and back then University of Gadjah Mada all focus on COVID-19 prevention and the effectiveness of social intervention during COVID-19 period. So it's just to show all of us that different organizations can actually use the data sets very differently according to a specific objectives or goals. There are a lot of areas that Data for Good is actually focusing on. Of course, economic recovery is one of the core issues of Data for Good. Disaster prevention, this includes health disaster as well. This is, I think, the strongest pillar in Indonesia. There are a lot of analysis on this. And of course, sustainability, right? And we try over the past few years to open more data and to increase the number of products or data sets available for public. Of course, these products that I show you on the screen, this is from last year. So as per today, there will be more data sets available in the Data for Good website. So for those of you who are interested, feel free to check the website under data and tools, you'll find all these products, right? The Peta Bencana, disaster map, future of business survey, and even the internet inclusivity index. All these are accessible from the Data for Good website. And you can see if a data set is publicly available, you can directly access it. However, if it's not publicly available, then you need to reach out to one of our partners. And we have CSIS here as well, as a partner that can access most of our data sets. So this is the privacy framework that we use for Data for Good. There are a few things that we do to make sure that the data that we share still protects our users' privacy. And I think most of this are expected when an organization is sharing data sets as big as ours. So the first one is, of course, the de-identification. So we don't, de-identification and aggregating the data. So we don't share personal data of our users, not on individual level, right? This is probably one of the most important privacy protection that we need to do. And I just have to assure all of you that we don't share your personal data as data sets, right? So we aggregate all this data. We also do noising of the data. So it'll be random just to make sure that no personal data is exposed. When we work with our partners, we get into agreement of the, data licensing and how they can protect our data as well. Data for Good is also controlled in terms of access. Unless it's publicly available data sets, you can't access all of our data sets without signing an agreement with RT. Data for Good is voluntary, so you can, if you don't feel like you want to share your location on Facebook, you can actually opt out from sharing it, right? All of the data that we collect is according to our data policy, which is also according to the privacy regulation that we comply to, be it in the US or in Europe as well. And for advanced feature like location history, it's optional, so you can opt in and opt out. And all of the data sets that we share are, we try to make sure that it's accountable and it's transparent according to international standard that we adhere to. So these are the privacy protection measures that we use when we do Data for Good initiative in a certain country. This is just one example of the population density maps. This map is showing you that the yellow gradient is showing high density of people who are more than 60 years, which help a lot of policymakers in identifying probably a target of a certain policy, right? So this is just one of the products that we have. This is population density maps for West Java. I think PulseLab used this during COVID. This is the same according to age group, so you can target, let's say, if a village or a regency is highly dense in people who are more than 50 years old, right? Probably they are more prone to COVID-19. You can target the vaccine there. Then we also have movement range. Of course, I will not go through all the products one by one today, but movement range is another product that we do. This is basically how a population react to social restriction, right? Do they really reduce their movement, or during social restriction period, they just move around, right? And CSIS, I think you guys use this several times for your report. We did a COVID-19 preventive survey, and this is in collaboration with Kementerian Kesehatan. So back then, I think, if I remember correctly, Pak Aji, please correct me if I'm wrong, when we first launched the vaccination campaign, there is some resistance, right? And the COVID-19 preventive survey actually identified the reason behind why people are quite hesitant to get vaccinated. Also, some of the other behaviors that are related to COVID-19 prevention, like mask wearing, physical distancing, hand washing, and self-isolation. So we presented this data to friends at the Ministry of Health, and thankfully it was received positively. And we did a press release on this, and basically to encourage more people to do preventive behaviors on COVID-19. This is just some of the examples that our friends at CSIS have done in the past. I think this example showed us that a certain report deriving from collaboration in data sets and how organizations like CSIS utilize publicly available data sets. And actually, I feel it elevates the analysis, right? And I heard from a lot of our government partners that they read this analysis, and it became a reference when they consider policy making, right? And when they formulate policy. This is just another example, the area discussion paper series. This is also spearheaded by CSIS, Yose and team. So I think these are just the results of the collaboration. And from our side at Meta, we are very, very keen to continue Data for Good initiative in Indonesia and to expand the initiative, right? So we're looking forward to continuing the collaboration with friends in the webinar. But also, if any of you have different ideas on how to use these data sets, we are very open to discussing. So I think that that is all of my presentation for today, Panis. Hopefully it's useful for the audience, and looking forward to the question and answers and discussions. And thank you again, CSIS, for championing this. And I hope that these type of collaborations can improve policy making in health sector and in other sectors as well, in Indonesia and other countries in Asia Pacific. So I give the floor back to you, Panis. Thank you.
Thank you, Mas Rino. It's a very interesting presentation and very timely as well, but with a detailed explanation of the product in Meta that could be used for public, either for research and also for supporting the policies. We also learned that there are also several publications that later on I think Mas Noory from CSIS will give more insight about that. But before Mas Noory, actually I also share some of the screen capture of presentation of Mas Noory to several WhatsApp group, and one also among the first question is how to collaborate with Meta. So can you answer directly, Mas Noory before Mas Noory later
on? So yes, how can you collaborate with us? This is there are two different answers. So firstly, you can use the publicly available data sets directly. That is, there is no pre-requirement for that. But if you want to use more data sets, you can, sorry, CSIS friends, you can reach out to our partner, which is CSIS, of course, and friends at the University of Indonesia and Gadjah Mada University as well. And if you are an academic institutions or research institutions and you are willing to collaborate in long term, we can open a discussion and see if we have potential collaboration, and we can start from there. And if there's alignment on the goals and objectives, we're very open to expanding our partners list in Indonesia as well.
Okay, yes, thank you, Mas Noory. I think we will continue the discussion. I have also some question after the presentation of Mas Noory, so we could catch up the discussion later. So I would like to continue this interesting discussion to invite Mas Noory. Are you, Mas Noory? Are you well?
Yes, at the moment I'm feeling well, Mas.
Okay, hopefully you can continue with the presentation. after some introduction of Meta, and we learn also from the presentation of Meta that CSIS is also among the important partner on using the publicly available data from Meta. I think time and screen is yours. Please, Mas Noory.
Okay, thank you, Mas Anies. Selamat pagi, everyone. Mas Yose, Pak Aji, and all distinguished panelists. I guess my presentation would be an extension of Mas Sarino already explained about data for good, because it's going to be based on the report that I wrote about the experiences in using data for good among Meta partners in Indonesia. Which contains a lot of best practices actually in utilizing tech-based data such as data for good among partners of Meta in Indonesia. And I am lucky enough to have a conversation, to have a talk with a number of these partners, including from University of Indonesia, especially from people from FKM UI, and then from UGM, from Pulse Lab in Jakarta, and also from Eijkman Institute. So my presentation would be heavily drawn from my encounters with these partners. So I have no slide presentation, but I have at least 3 points that I want to share with you today. Number one, I think I want to emphasize about the timing of granting access of this data to partners, which is very important if you want to understand the efficacy and the effectivity of data for good for Indonesia. So as I wrote in the report, one of the most crucial aspects of data for good was its ability to provide partners with a set of real-time data in a very timely manner. So especially at the beginning of the pandemic back in 2020, when the availability of real-time data was still considered very, very rare. It's hardly available. So just to give you a sense about that, shortly after the first COVID case was found in Indonesia, it was in March in 2020, we at CSIS already get access to data for good, or which was previously called Facebook Prevention Disease Map. And I remember back then, our then executive director, Mas Philip Spermonte, asked me to join a small team that he created, comprising a number of researchers from different departments at CSIS, to learn from that data and to explore the data. However, at that time, I recall I have no experience whatsoever in working with big data like Facebook data, nor having practical experience in working with that kind of data. I think the same is true for many of my colleagues at CSIS by then. But I think in part because we have nothing more interesting to do by then, because we just stay at home all day. It was still at the beginning of the pandemic, so we kind of follow the stay-at-home orders, PSBB. So we have spent a lot of time to look at the data, to explore the data, and to figure out what we can do to make sense out of this data in order to make a meaningful information from it. So we finally managed to come up with at least 10 short papers or response papers that we produced through our own outlet, which is CSIS Commentaries. And these articles were published in a very timely manner, I would say. It was published during the first 2 months of the pandemics in Indonesia. So they were published between March, April 2020, which is very important, I would say, because in the first 2 months of the pandemic, people might already saw some graphics, some figures, some statistics maybe you read some tweets, about how bad the situation was for our country, how severe the situation could become for Indonesia in the next few days or few weeks. But having structured articles, written formats of article using real-time data such as data for good was still very, very rare by then. So I guess we at CSIS were among the first institutions that came up with written articles at that time. And that fact might kind of embolden our impact and our subsequent activities with regard to our COVID-19 pandemic response at CSIS. So I remember, for example, when I wrote the report for Meta, these 10 articles alone written by my colleagues at CSIS, it's already been downloaded by more than 20,000 downloaders, not to mention the number of articles that were widely circulated in many WhatsApp groups. Some were translated into English, some were published by the national media, and in fact, some of my colleagues were asked to give presentation to policy makers because of what they wrote in that papers. And interesting enough, from our standpoint as researchers at CSIS, is that how data for good at Meta can be an entry point for us to leverage, our own activities at CSIS. So I remember, for example, CSIS commentaries, when it was created, it was created for us researchers to give a response about many issues within our own expertise. But when we publish articles by using data for good, and then we saw public response with regard to that papers, then we have decided to to make these CSIS commentaries to become a share and open platform for general public. Yeah. So we invite researchers outside CSIS, including practitioners and also policymakers, to share their thoughts, their ideas, primarily about COVID-19, of course, but then we extend the issues to multiple other issues outside pandemic. Yeah. So about disaster management, about political, economic, and also security issues. And then we were surprised by the numbers, by the statistics of our own CSIS commentaries, because by the time when I wrote the report for Meta, we already have over hundreds of articles written in these commentaries, and they had been downloaded by hundreds of thousands of downloaders. So it's pretty big numbers. And I would say that achievement could happen because the timing when we get access to this data, it's very, very, very timely. And then the last thing is that about how we can leverage our activities after that. So, for instance, our colleagues at economics department led by Mas Yose, they created a COVID-19 dashboard, again by utilizing big data from Data for Good, and then they combine it. The economic researchers from CSIS combine it with multiple sources of data. For instance, from BPS, from government statistics, especially about the economic indicators, economic activities in many provinces in Indonesia. So we can have a kind of relationship between the COVID-19 development and also related with our economic development in particular areas in a given time. So that's one of the outputs that we can have by utilizing this data. And then the second point is that I want to talk about the impact that we had by having tech-based data such as Data for Good. And by that, I think we also have to differentiate between what I call the direct and indirect impact of Data for Good for policy making in Indonesia. So what we have done at CSIS through CSIS commentaries, we had a webinar, COVID-19 dashboard, and so on and so forth, could be classified more as an indirect intervention throughout the pandemic. But some partners, they can have more direct intervention actually to policy makers. So from my experience talking with some partners such as Pak Iwan Aryawan, from FKM UI, he told me how he, along with Pak Pandu Riono of FKM UI, got access to a lot of key policymakers at provincial and also at a central level of government, and they asked Pak Iwan and Pak Pandu Riono to give a regular feedback. For instance, Pak Iwan and Pak Pandu were asked by Gubernur DKI Jakarta, Pak Anies Baswedan, to give regular feedback about mobility, the extent to which people stayed home because of the PSBB, for instance, and they gave Pak Anies and his team graphics, facts and figures, numbers every Sunday. In the first years of the pandemic. Why is it on Sunday? Because on Monday, that data would be used by the governor and his team to hold a regular meeting on COVID-19 development in Jakarta. And then the partners from UI also got access to basically all major provinces in Java. Central Java Governor Pak Ganjar Pranowo, West Java Pak Ridwan Kamil, Governor Banten, and then Governor Yogyakarta, although less frequently than compared to Jakarta, but again they gave a regular feedback to key policymakers at local level as well. So in a way, they also have a direct intervention to policy making, and also if you hear Pak Luhut Binsar Panjaitan, our coordinating minister of maritime affairs and the person who's responsible for handling the COVID-19 pandemic across Java, when Pak Luhut made a public appearance on TV announcing whether or not we have to extend the level of PPKM or we have to reduce the level of PPKM in certain areas in Java and also elsewhere, he was quoted to refer to Facebook data, actually, especially about the mobility trends of people in Indonesia. Here he was quoted to say that he was referring to Facebook data in making decision. With other sources of data, of course, such as data from Google, data from NASA, but in a way, that means I think a tech-based company like Meta can have a direct intervention as well. Can make a difference in helping us navigating this public health response in Indonesia. And the third and the last point that I want to make today is that how Data for Good could become a learning platform for researchers from different backgrounds to learn from each other, and how Data for Good can also be used to learn different issues beyond COVID-19 pandemic. So from my conversation with people from Eijkman Institute, for example, they told me how the mobility data from Data for Good can be used to understand the patterns of some infectious diseases, such as malaria, DBD, and also HIV. So they have people in Egman Institute. They then have ongoing research with University of Melbourne in understanding the impact of malaria in Indonesia. And they told me how the data about population density map and also mobility map, movement range map, for instance, from Data for Good can be used to understand how the movement from highly contagious malaria areas such as Papua and Nusa Tenggara Timur, they can be used to predict the rate of infectious disease in other areas in Indonesia. So actually it can be extended to learn other issues beyond COVID-19 as well. And then at UGM, Pak Anies colleagues told me that Data for Good becomes a shared platform among many lecturers to do research across different schools and faculties. Yeah, so my conversation with researchers from UGM, they told me how they now engage in a multidisciplinary research between researchers or docent from Faculty of Forestry atau Fakultas Kehutanan, and then Faculty of Economics and the Faculty of Medicines. They are now working on the research on how human behavior affects the development of virus transmission in Jabodetabek. So that's one of the ongoing research at UGM. And then at UI, UI Rector created the big data team, or what they call Team Mahadata UI, to work with big data from Meta, and Pak Iwan and Pak Panduriono were part of this Mahadata team, along with some other lecturers from different faculties, from Faculty of Economics, Faculty of Medicines, and Faculty of Psychology, among others. So cross-cutting collaboration between researchers, between lecturers from different backgrounds can be done. And I think this is one of the most promising development of tech-based data, such as Data for Good, for many researchers in Indonesia. So I guess that's all my presentation. I will stop there and hand it over to Mas Anies.
Thank you, Mas Noory. It's very insightful sharing, especially the 3 points that you have mentioned. Before to Mbak Dyana, I just would like to ask one question, Mas Noory. As a researcher, you compare about publishing papers, the impact of research to the policymakers. Compared to your previous track as a researcher, when you publish several articles using Data for Good and it has been downloaded 1,000 times, how is comparison of this paper based on Data for Good with other paper? Either in other paper you have also experienced the same thing, that your publication finally received public attention as huge as using Data for Good?
I think for Data for Good paper, it's more impactful, Mas, because of the timing, of course.
Yes,
right?
The timing,
and then the nature of the paper, it's quite short, actually, because it's more about response, our response to the ongoing situation. So people we can really grab attention from public by publishing that papers. And it's not only about the numbers of download, actually. We were surprised by, how many papers were circulated among group chats that we part of that group chats, and then we all of a sudden got a call from journalists, from media, and then we got invitation to talk with key policymakers. So that papers led us to many more opportunities, actually, and in a way, it has a stronger impact than the previous research, previous paper that we wrote at CSIS.
Agree. Yes, it's a very interesting to learn about this this lesson learned. I think in Indonesia there are many faculties, many research centers, And also those who attended this session, I see as well several colleagues from universities, from Ministry of Health, from Research Center. I think this is a very insightful lesson learned that we could also important to cultivate, to increase, to strengthen later on. But before we continue more detail on the discussion, I would like to invite our colleague, but it is quite different. Mas Noory is from the think tank, from the Research Institute, but Mbak Dyana is from the government. Mbak Dyana Jatnika is from the Jabar Digital Services. She's the head of implementation. And I think Mbak Dyana has a lot of insight regarding using the publicly available data to support directly inside the government to improve the services, to improve, I think, many public services to the people. I invite Mbak Dyana to share this experience. So time and screen is yours, Mbak Dyana, please.
Thank you so much, Pak Anies, and greetings to everyone from Bandung, West Java. I'm Dyana Jatnika, currently working as the head of implementation at Jabar Digital Service. So I'm going to share with you now some of my own views about the significant use of data, including publicly available data. But in the context of the discussions, I'll be quite tight in terms of what I'm going to share because of the limited time. But I would like at the end of my speech for you to share with me a sense of that to have data is really crucial, but to have the environment within which it is possible to share data is even more important. I will try to explain why I mean that in the coming few minutes. So Mbak Nadia, would you mind helping me share? Thank you. All right, thank you very much. Would you mind moving to the next slide, please? Yeah. Okay, so this is West Java in a glance. So West Java is one of the biggest provinces in Indonesia, almost 1/5 of Indonesia. It has more than 5,000 villages, almost 9 times higher than its sub-districts. So people living in underdeveloped villages with blank spot areas probably would find more difficulties in accessing any information about updated data or even any services available for data COVID management. Also, with its 8 regencies and 9 cities, West Java has its uniqueness, where each city and regency has their own autonomy. So the provincial government has some limitations in intervening their own public health management system, including the data management. Next slide, please. All right, regardless of where we are joining right now, we are all experiencing a prolonged emergency in light of the coronavirus pandemic. So in West Java, the number of active cases has been decreasing these days. Having said that, we are still optimizing our efforts to tackle this pandemic with all services available for the citizens. The next one, please. All right, so speaking of data, in West Java, we have an integrated system called West Java Data Ecosystem, consisting of One Data, One Map, Open Data, Data Analytics, and Data Dashboard. All of these are used not only by the government itself, but also publicly available for all citizens. So I'll explain next, please. All right, so this is like general definition of Jabar Open Data, One Data, and One Map that we got in West Java. For public, there is Jabar Open Data, where you can access any data provided by all government departments in West Java. So Jabar Open Data aims to promote accountability of the administration to citizens, whilst also encouraging public participation in accessing more transparent data from stakeholders. We are also having One Data and One Map, which are used mostly by the government themselves because we are promoting one platform for data in all departments in West Java. Next, please. All right, so this picture shows you how our data management is running into one integrated system for COVID-19 management. So the data is collected from different sources, ranging from the central government, provincial government, local government for each city and regency, and definitely external sources for publicly available data. We specifically collect the data, for example, from Waze, Facebook, Google, OpenStreetMap, and other resources into one platform and are integrated with other data from the central government and the local government. Next, please. So yeah, from all different data sources, the Jabar or West Java data ecosystem strongly supports a more measurable decision-making and policy formulation. And also the data is divided into executive and public dashboard. So as I have mentioned before, that the data is not only used by the government themselves, but also can be used or accessed by the public itself. Next one, please. All right, so the next slides will explain about how we use data for the government. So in terms of the executive one, or for the government themselves, both in the province or local governments, to monitor the data for COVID-19 management, the data are collected from the central government systems, the provincial government data itself, and the local government. So we got like 3 sources from this executive dashboard from all governments, ranging from central, provincial, and local governments. And then I'll show you some example of how we are managing that data. The next one, please. This one, I put an example from last year. So this slide is one example that show you that the data analytics we regularly update for the provincial COVID-19 task force. The data is collected from the West Java Health Department. So we analyze the COVID-19 active cases during some long holidays or break, that hopefully it will become an insightful insight for the government to make proper decisions based on data. So this picture shows you how we collect the data from the provincial government data. And the next one, please. And this one, an example of how we are collecting data from the central government system into a pic that can be used for analyzing the vaccination progress in West Java. So before, this slide before, explaining about how we use the data from provincial, and this one, how we use the data from the central government. Next one, please. So this is about the daily traffic rates in West Java. In terms of publicly available data, as I have mentioned before, we mainly use Waze, Facebook, Google, OpenStreetMap, or even UCLA to help us with data analytics for citizen mobility during pandemics. As you can have a look here, for example, we use Waze data to analyze the daily traffic rate in each city and regency in West Java during the restricted mobility policy after Ramadan in homecoming session. So it is interesting that some cities and regencies in West Java that are not part of agglomeration areas have significant increase in daily traffic because they have main routes for people living in Java Island to travel back home. So we use the Waze data to analyze how the mobility, the citizens' mobility can move during the Ramadan or in the restricted mobility policy. The next one, please. All right, this one, we use the data from Google Mobility Reports. This is one example that we used for last year. So last year, when Indonesia officially imposed restrictions toward community activities or PPKM Darurat, we also analyzed citizens' daily mobility to office and public transportation. The next one, please. Yeah, so this one, an example where we use Facebook from Facebook Move and Range Maps to analyze the stay-at-home behavior during PPKM or the restricted mobility, particularly in West Java. All of these examples are used by the executive or government stakeholders to make any decisions based on data, particularly in some, like the implementation of the PPKM Darurat or restricted mobility policy. The next one, please. Hopefully I still got the time. Okay, we are also providing data for citizen. We got like citizen dashboard for COVID data management. You can access any active cases or bed occupancy rate or any other data, including services that people can use to access any service provided by the provincial or local government. And the next one, please. I'll explain to you how we are collaborating with the central government and also other partners, which is Puslab Jakarta, to create a COVID-19 potential and risk transition map. So this is publicly available data that we provide on Picobar platform. You can access this map on our platform in Picobar. So this is a joint collaboration between Jabar Digital Service, Puslab Jakarta, and Pusdatin Renbang Bapenas to conduct data exploration and analysis from June 2020. So it's almost 2 years, yeah. So this innovation implemented by utilizing conventional and alternative data sources to identify areas that have the potential and risk for the spread of COVID-19 at the village level. So you can have a look on the map that we can, like navigate which village that are on the red or yellow levels, yeah. So the data analytics is useful for providing information to relevant policymakers in carrying out local quarantines, limiting activities, increasing COVID-19 testing, and improving health protocols, etc. So the next one, please. Oh yeah, okay, so the source of data, we got the data from the Department of Health in West Java and also from the central government and from Google Places API and also from Facebook. So we combine a range of data sources ranging from the central, local, provincial governments and also publicly available data from Google and Facebook. So these are two examples of the utilization of potential and risk map dashboard in policymaking. So the map is one of the indicators used in clustering or grouping which schools are recommended to be reopened. Yeah, so last year we used this map to make any decision making about which schools are good for reopening. So for the sub-districts in the red and yellow clusters, they are not recommended to reopen to the face learning activities. And also, we are also working closely with Satpol PP in West Java or West Java Municipal Police to have operation points of health protocols enforcement in some areas clustered in specifically red and yellow areas. So yeah, these are two examples where we use this map to make any decision making on policy based on data. The next one, please. All right, so I think these are the last slides. Furthermore, we are also optimizing the roles of community leaders in West Java for data validation for social benefits delivery last year. Yeah, so last year when the central government distributing, not only central, yeah, but also the provincial distributing social benefits, our bansos, we have Sapawarga app as a super app for all community leaders in West Java to communicate between with the West Java government. So the next one, please. So all community leaders are promoted or encouraged to also participate in data validation by accessing menu bantuan sosial on Sapawarga or social benefits, and thus they can verify data of social benefits recipients with a range of data status, including verified, not verified, and declined. So data we use not only approved by the government itself or publicly available data from any other sources, but also we encourage the citizens to provide data. I think this is the last slide, isn't it? The next slide, please. Yeah.
Okay.
All right. Yeah, that's all from me. Thank you very much, Pak Anies and everyone for listening to my presentation. And I look forward to hearing any feedback and having fruitful discussion with you all. Thank you.
Okay, thank you, Mbak Dyana. Again, it's a very interesting presentation from the third speaker in this session. We learned from Mbak Dyana that among the aspect that I think is also very important is Jabar Digital Services also using multiple platform that provide many available data. Mbak Dyana mentioned about Waze, about Google, and also about their own platform, Sapa Warga platform. I think this is a very important. And I think with about 34 provinces in Indonesia, I think Jabar and also DKI will be among the excellent model on how the provincial level could collaborate and also could develop the platform. And we have also the last speaker in this session, Mas Juan. I think we have, hello, Mas Juan. We have also heard from the first speaker that among, and also the second speaker, among the important partner is also Jakarta Smart City and Pak Gubernur, which is fortunately the same first name with me, Pak Anies, also actually very active on using data from publicly available data to measure and monitor the response to the on the pandemic control. So I invite Mas Juan to share how Jakarta Smart City using the publicly available data to respond the public health aspect and also to control the pandemic in the last few years. Please, Mas Juan, time screen is yours.
Okay, thank you very much. And I hope my voice is clear, and allow me to share my screen and let me present this fully. Let me double check to Pak Anies as the moderator. Can you see my screen clearly?
Yes. Okay. Yeah, clearly. And the slides, okay, please.
Thank you. Okay, I will continue with my presentation. So I think I discussed this before to the CSIS PIC, or the event organizer. I think I will share briefly to give trigger for our discussion later. So maybe just around 5 to 10 minutes. So the title is about utilizing public data in strengthening our public health. Yeah. So as already mentioned, I'm Juan Kanggrawan, the current head of data analytics and digital products at Jakarta Smart City. So in simple words, I think in Jakarta, we are highly interested to analyze and utilize both public data, internal data, in order to provide better public service, better decision, and also better policy. I think that is the essence. And again, a bit introduction about myself. Feel free to reach me. You can see my personal website as well to get more details about me. And I am highly open for discussion, engagement, and so on. So you can reach me via email, via WhatsApp, and so on, as mentioned in this business card. Again, so when we talk about public data, I think we need to align with the direction of the city itself. So in Jakarta, I think we want to go to City 4.0. There are many definitions about that, but one of the important aspects is how the citizen and government can collaborate in a more dynamic manner. So it means from the government, we are not only providing information on our services, but we want to sit down together with all the elements in the society, can be from the business, from the industry, can be from the university, NGO, and so on, and how we can develop the solution together. And for sure, the public data, open data will be the important aspect in this context. Again, for us in Jakarta Smart City, we see a lot of trajectories of Smart City. So for us, we are seeing Smart City firstly as a data, then moving forward as a service, platform, hub, and ecosystem. It means after we collect the data, can be from internal, from external, structured, unstructured, then we want to ensure that the data that we collect, we can generate a good platform, a good service. As you may know, in Jakarta Smart City, we're building our super apps, so-called Jaki, Jakarta Kini, and we also want to work together with all the elements in the ecosystem to build a more exciting digital ecosystem, especially in handling COVID-19 context. So I think that's the idea. So based on this perspective, I think it is highly aligned that we want to utilize publicly available data and how we can generate a concrete impact based on that. And this is just a quick note about the data that we are managing in Jakarta Smart City. Not all of them are owned by Jakarta Smart City. Sometimes we need to work with all the relevant dinas, SKPD, or the government agencies. Can be from health, from the citizenship, from the education, from the transportation, and so on. So we have data about citizen aspiration, transportation, tax, flood, subsidy, health, COVID-19, and so on. So I think in the past 2 years, especially, we have been working with the government agency in Jakarta level, with the national ministries, with the research agency, NGO, and so on. Again, our idea is not only to collect the data and generate dashboard or research by from our own perspective, but we want to ensure we have sufficient domain expertise. That's why we are highly open when we want to work together, including the people from CSIS, from Mada, from other universities, from other NGO. We work together with some researchers as well in our collaboration with, let's say, Berlin, Japan, South Korea, and so on. So in the end, what we want to do after we consolidate the data, we build the data assets. Then from there, we work together with the relevant experts to ensure that we have in-depth knowledge base and we can be accountable from the research and academic perspective as well. So this is some of the idea that we have been working on so far. So we are not only consolidating the data, but we want to share as well what are the ongoing works, what are the key priority in terms of the problem statement that we have in Jakarta, and we want to work together with all the elements in the society. Can be startups, can be research, can be universities, in order to have what we call the innovation lab. It means based on that data, then we can generate something in the initial phase or pilot. And if the progress is good, if the progress is really positive, can be about startups, can be about pilot initiative, can be about research, then we want to scale up accordingly. So I think in the COVID-19 context, we have been doing a lot of initiative from this perspective. Can be about the social mobility limitation, can be about the social aid distribution, can be about the, opening the schools, working with the relevant partners, and so on. So I think this is just an example. I will not go to much details about this, but in our website, coronajakarta.go.id, we have been publishing a lot of information about the dashboard, about the trajectory of COVID-19, about the geospatial analysis, about the collaboration for the social aid distribution, about the schools opening, and so on. So we try to ensure that we can have an integrated platform that can be used with for the public, for research as well. Even we work with some of our partners and we share the results on our website as well. So it's not purely from the Jakarta government or Jakarta Smart City, but we want to ensure all the collaborators or the partners, we share the result as well in our integrated platform. And for sure, we have been working with the National Ministry as well, with the Digital Transformation Office. So we want to support the ongoing ecosystem about the digital health data, let's say with Peduli Lindungi and with all other relevant startups and with all the relevant applications, how we can ensure that we work together to help with the COVID-19 responses. So Jakarta Kini is one of them. It has been used not only for the vaccine scheduling, it's also for the monitoring of the live COVID-19 situation from multiple perspectives, from the healthcare situation, from the mobility, from the social aid, from the school, and so on and so forth. Lastly, from our data, from public, from internal data, we have been using data from Facebook as well, Data for Good, or from Meta, also from Google, from Apple, and so on. So we consolidate all those data for our policy assessment, policy review, and also we have been doing the weekly report as well. So for our governor team, head of agency, for them to be able to understand the latest situation of COVID-19. And I believe, as already mentioned by the previous speakers, that we have been working, let's say, with the University of Indonesia as well, to have these kind of indicators and weekly or more regular monitoring. So in essence, let me stop my screen over here. So what we are trying to do so far with the public data, we see that as a very good momentum to collaborate together with all the relevant actors in the ecosystem, and how we can ensure, based on that public data, combined with the internal data, we can provide a better policy and we can provide better services for our citizens and for our ecosystem. I think that is the quick sharing and a quick journey from Jakarta Smart City, especially in handling COVID-19 and utilizing our public data. Thank you. Over back to you, Anis, as a moderator. Thank you very much.
Thank you, Mas Juan. I think the last presentation also underline how important is publicly available data, and it shows that the Jakarta province, the government also very active on using this data, and also develop a model through innovation lab to invite all partners that could be invited to join together to use publicly available data to support many public services and to give impact to the community. I invite all panelists to join in this Q&A. Actually, we already received many questions, very important questions. And I will start first, I think, to Mas Rino. Mas Rino, are you still here?
Yes, Mas. Sorry.
Okay, Mas Rino, I have picked one question from Dr. Grace Wangge. She asks whether Meta have anyone make analysis on the issue of health disinformation and promotion of unhealthy product, for example, tobacco product in Indonesia. Is there any certain platform policy that prevent disinformation and promotion of dangerous substance, and also make the data from Meta might be biased for such analysis?
Thank you, Dr. Grace. I think the answer for this is very direct. We don't allow tobacco promotion in Meta, so that's why currently we don't have analysis on that topic. Especially for ads, tobacco products is not allowed to use our ads feature.
Okay, yes. Thank you, Mas Rino. And I would like also to continue the question. I would like to select one of the questions directly to Mas Juan. I think Jakarta and also Jawa Barat shows an example of very active province to develop the platform and also to work with the publicly available data. I think the situation probably different from province to another province. So among the question is, I think, how the province, I think start with Mas Juan, how the province finally pull the talent that you can grow up as a team and also work to support Jakarta Smart City. Is there any example insight that could be shared to other provinces?
Okay, sure. Thanks for the question. But before I answer, allow me to give quick remarks here. I think quite similar with Mas Rino as well. I need to excuse myself in the next 15-20 minutes. Really sorry for that. And I hope I can address sufficient questions here before I leave for my next meeting. Apologize for that. So quick answer for your question. I think I received this question a lot. Yeah, it's quite a common question. So I think there are multiple layers of this question. First, how we can attract talents. Secondly, how we can ensure data-driven culture, data-driven initiative across government institutions, not only Jakarta Smart City, but also other relevant agencies. So I think my concrete answers, I think I have 2 points. First one, I think in terms of hiring, we must be open from multiple possibilities. Can be, let's say, from the fresh graduate, can be from our data science trainee or intern, can be even from other agencies who want to work together with Smart City, even with other international organizations. So how to, and sorry, there's my kids over there. There's a background noise. So if you want to ensure we attract the talent, I think we want to prioritize as well. What kind of analysis, what kind of impactful data assets, data products that we want to build in the future. I think based on that, we'll be clear what kind of talent that we need. I think that's the first tips that I can share. And secondly, I think when we talk about data-driven initiative, it's not sufficient to talk only about our internal institutions, which is in this case, maybe smart city, or let's say digital service, or let's say transformation office. I think we need to think how we can ensure scalability. It means we talk about 200, 300 government agencies in Jakarta. We talk about other ministries, other provinces in Indonesia as well. So in this spirit, we have been very frequently sharing our journey, our lessons learned, our tips to other provinces as well. I think by doing that, hopefully we can share our lessons and we can scale up our data initiative to other provinces as well. For sure, from me personally, I'm really happy to see other provinces like West Java, let's say Surabaya, or let's say Makassar, North Sumatra, who are really growing rapidly in utilizing data innovation and so on. And hopefully those other provinces can grow more and more in the future. I think that's my comment. Thank you.
Okay, yeah, I think I hope that Mas Yuan still have 2 or 3 minutes before you leave. There is also another question that I think is also very relevant. We know that currently several provinces right now, the governor also terminated the term, and also Jakarta will soon, Jabar will soon. And among the issue is how to sustain the innovation even though the leader changed to another leader. Is there any initiative in the province to ensure that you, as the guardian of innovation, will continue the innovation, even though the leader politically will be chosen by the population, will be a different person to current leader?
Okay, sure. I think allow me to give a brief answer for that. I think it happens as well in the industry, whereby our, let's say, C-level, director, VP can always change right from time to time. So I think in my personal experience, at least in Jakarta, as long we have a key metrics, or some people call that the North Star metrics, that is highly important, that is relevant, I think we don't need to be afraid with transition of the leadership, with the administration and so on. Because as long as the initiative is useful for the government, it's useful for the city, it's useful for other government, other agencies, I think doesn't matter. The key leaders, I think it will sustain. And I think in the last at least 3 to 4 years, Jakarta Smart City, I have been seeing some of the initiatives are still continuing and they are still improving as well. I think that's my answer. So it's also an encouragement that we should rethink and step back what kind of initiative, what kind of strategic direction that will be useful, that will be beneficial, let's say in the next 5 years, 10 years, 20 years. Because in government, we should tackle the urgent issue, but at the same time, we need to think in the more strategic and long-term manner. I think that's my response for that question. Thank you.
Okay, thank you, Mas Yuan. I will continue the discussion to Mbak Dyana. Mbak Dyana, I think it is also still related soft issues question, but it is a very important. The question is related to the training aspect. It is also related to the human resources who are involved in the Jabar digital services. How GDS maintain the skill of the staff, whether any regular training or any capacity building continually developed by GDS to ensure that the product will be released with high quality and also ensure the services to the public.
All right, thank you, Panis, and thank you for the question. So yeah, in our internal system, we got like some regular training for our internal staff, and also we got like some open training for citizens also, not only for the GDS in this Kominfo Jabar or Department of Communication and Informatics, but also we have some trainings for other government staff in other departments in West Java. For example, we have Jawara Data. Perhaps it also answers other question. Jawara Data or Data Champions are a program to train some staff in each department in West Java province, provincial government, to have basic skills for management data, for data management. So we got like some trainings, not only for internal staff in JDS, but also we have trainings for all staff, you know, like for the Jawara Data program in all departments in West Java provincial government. Data champions aim to train or, you know, like, train or produce some data talents or digital talents in each department. So we hope that each department can make regular digital transformation in their office. And also we have another program called Chandra di Muka Jabar Kodingkam. So this is a training for all young people in West Java, not only in our province, but also for other young people in Indonesia. This program aims to provide scholarship for young people to become digital talents in West Java, particularly because we got like some issues regarding supply and demand for digital talents. So all trainings provided by Jabar Digital Service, not only for our internal staff, but also for other staff in the West Java provincial government and also for other young people in West Java. Perhaps.
Okay, yes. Yeah. Okay. Thank you, Mbak. This one I will continue for technical aspect. It is related to the Sapa Warga application. I think, would you mind to share a little bit about the user engagement of local government application of, for example, Sapa Warga? We know Jaki as well, but I think from the Jawa Barat perspective, how is the engagement of local user on using this kind of application? We know that I think rather a smaller specific users compared to, for example, Peduli Lindungi, we know that 60 million of numbers. How about this kind of specific application?
All right, thank you, Pak Anies. So, Sapa Warga Super App is an app or digital tools to communicate between citizens and the West Java government. So, currently, Sapa Warga app is used only for all community leaders or RW in West Java province. So, this is not open for public yet, but we are aiming to have an integrated super app platform called Jabar Super Apps. We are still developing this. So Sapa Warga app is particularly used for all community leaders because the West Java governor was concerned about the participation of all community leaders in West Java for, like participating in provide aspiration or access public services or access any information provided by the West Java government. Currently, we got like more than 45,000 community leaders in West Java participated in the super app. They can access any services or information provided by the provincial government and even social ad verification that I have mentioned before. So they participated in data validation for social benefits. Last week, the community leaders are also encouraged to participate in mie goreng, minyak goreng, kelangkaan mie goreng. They participated by using the super app to communicate with the provincial government by providing an aspiration or access the services provided by the government itself.
Yeah, it is interesting. Probably the discussion in Sapa Warga will be different compared to the, I think, high tension discussion in the social media regarding minyak goreng. Sure. I'm just wondering whether it could also cause another burden of local leaders on using these local apps. Okay, I would like to continue to Mas Noory. I hope Mas Noory still here.
Yeah, Mas.
Yeah. Mas Noory, I think when we learned some insight either from Meta and also Jawa Barat, and we learned also from Mas Noory that the CSIS also already use the publicly available data. Do you have any insight from CSIS perspective how to incentivize the government to use this publicly available data? Yeah, any insight about that?
Well, I think from our experience, it really depends on.
I think your voice is not.
Can you hear my
voice? Yes, please louder, Mas. Okay, yeah.
Yes. What about this time?
Yeah, okay, good. Yeah.
Yeah, I think from our experience, it really depends on the way local government reach out to experts on these issues. Yeah. I think we also have to pay attention to whether or not the local government have data that they don't have. Yeah, when it comes to, let's say, mobility trend, when it comes to, let's say, population density, those kind of data could only be fed by tech-based company like Mada. And then for us as researchers, our task is to really work through this data, and then try to, if you have an access, then you can give that information to key policymakers. But when you only work with data that local government already have, I think they will not really pay attention to that information.
Yeah, thank you, Mas Noory. And I think with regard to the incentive for the local government, not only depend on the leader and also the need and also the availability of data, but also how easy to access the data itself. I would like to follow up to Mas Noudhy. Based on the existing collaboration with, for example, CSIS, local government, and also university, is there any challenges on how easy to use the data in Data for Good, and whether, for example, with the different available data in Data for Good, but how far is the extent, or to what extent the data already used currently by many users, whether specific detail of data currently are not interested, or probably the detail is too complicated to be analyzed so that the utilization is low compared to others. Is there any insight, experience about that, Mas Noudhy?
I think this is a suitable question for CSIS as the user.
Yeah.
I hope it doesn't face it doesn't give us difficulty, and we're quite fortunate actually, because of the active partners that we have in Indonesia. Our country is now looked at as one of the global case studies for Data for Good, right? In fact, I think Mas Noory just appeared in one of the global interviews for Data for Good, right? This type of activity helps us to get more support from, of course, the Meta internal team and other partners in other countries around the world as well, which I hope leads to better understanding and better support for our partners. But yeah, that's my impression for now. And of course, Mas Anies, there's challenges in expanding Data for Good program, and I think it's very similar to what to the question for Mas Juan earlier. In our organizations in Indonesia and other countries, sometimes there's change of leadership, sometimes there's change of structure, and we at Meta have to sort of like keep up, right, with the current leadership and structure to make sure that the program is still running sustainably. I think that's the keyword. If we want to launch one or two initiatives, should be easy, but how we can make the collaboration more sustainable is the question. Is the big question that I always ask. So I think that's the challenge for us, and for the usage of data. I think Mas Noory and friends can share more.
Yeah. Okay. I will continue to Mas Noory or Mbak Dyana or Mas Juan. Do you have any insight regarding the challenges to counter the difficulties to access and to utilize the data?
Can I answer that first?
Yes, please, Mas Juan.
I need to excuse myself after this. So it's about the data access. So I think allow me to share this. After that, I need to excuse myself. Apologize to all the panelists as well, and to Mas Anies as the moderator. So I think first principle, data should be easy to be accessed. And second one, not only accessing the data, we need to ensure the benefits or the utilization of the data. So first, in terms of the access, we have the open data portal in Jakarta. That's one thing. But again, not everyone knows for sure, and that's why we need to be proactive in presenting and also in communicating. Hey, we have this kind of platform. Hey, we have this data and so on. So I think that's the initiative that we have. That's why we have, let's say, our data science program. We have our hackathon utilizing our data. We have our bootcamp and so on. So I think in the end, that's the idea. How we can ensure that we have the open data platform, and we want to tell the ecosystem that we have this, and let's build something together. That's the first one. And second one, I think we don't want to stop the data data only as the so-called dashboard or report or paper only, but we want to ensure there is concrete utilization. That's why I think the mindset moving forward is to ensure a lot of services, a lot of applications, a lot of ideas, that can be generated through this data. I think that is the approach, at least from the Jakarta perspective. I'm not saying we are perfect. I think it will take years to develop this, but moving forward, we hope that we can build more open and interesting API from Jakarta that can be used, let's say, with in Jakarta with Jaklingko, for example, with MRT, LRT, so we can build application and services that will be highly useful for the citizen and ecosystem. I think that's my comment about this, and apologize, I just excuse myself. Thank you, everyone.
Okay, thank you, Mas Yuan. Please, Mas Yuan. Mas Noudhy, probably do you have any insight regarding the data access and also ease of use of the data?
Yeah, I think regarding the easy use of the data, from my experience, of course, you need some level of familiarity and training in order to be proficient in maximizing data for good, Mas. And in order for you to be proficient and familiar with the data, that requires some sort of trainings, unfortunately. And the way what we did at CSIS is that we rely on, let's say, an organic communication between this small team at CSIS. So we share some codes, and then a friend of mine got a coach from outside source, let's say from, if I'm not mistaken, from University of Melbourne. So the data is already there, but it's not actually ready to use data. But you need some code, some training to process that data in order to get a meaningful visualizations, for instance, meaningful information about it. So training is something that we have to have first. But I would say that if Mas Rino is here, if Meta as the provider of data could probably have more workshops, more hands-on trainings to partners in Indonesia and then to general publics, the way you can use this data in more practical way, for instance, that would be so much helpful, I guess, for many of us.
Thank you, Mas Noudhy. I think the last question, I think to Mbak Dyana and also Mas Rino. I think to Mbak Dyana first. One of the question is, you have already presented a lot of applications, and then do you think that it will cause another confusion to the population or the staff at Jawa Barat, given that there are many applications and which one need to use, etc.? Or any plan to integrate or any other insight about this?
All right, thank you, Panis. Interesting question. So the first one about West Java data ecosystem that I have explained before, So we got like 3 apps integrated into one each other. So actually, this is one integrated platform, but we separated it into some platforms because the target is different. For example, open data, it is for public to access any data provided by the government. One data, it is only used by the government itself. So all data sources come to one data, and then from one data, it is integrated or separate or spread into one open data and one map. So one map, it is an application to a platform to provide any geospatial data. So it's different formats with open data. Actually, it is integrated into one platform called West Java Data Ecosystem, but for different target, it is different use. So that's one. And for other application like Sapa Warga, Picobar, we got like some apps in West Java, Sapa Warga, Picobar for COVID-19 pandemic. And then, Sapa Warga and Picobar. So these 2 apps, we are aiming to create Jabar Super Apps. It is still developed currently. So we hope that in August or September, we can publish this Jabar Super Apps for all citizens in West Java.
Okay. Thank you. I think you will go to more and more integrated and complete super app platform for Jawa Barat. I think the last question in this interesting Q&A will go to Mas Rino. Among the question from the attendees is currently, even though the pandemic it is said that we are going to the endemic situation. But we heard in the last 2 weeks the new disease. We heard about potentially for another outbreak, the hepatitis A, for example. Given this opportunity, this potential for outbreak, whether in internal of Meta also consider, for example, new disease, new potential outbreak, new potential disaster, also part of the alert or surveillance, so that later on you will also release another data to be used for the public regarding the surveillance, a new surveillance of disease or potential outbreak like this?
Yeah, thanks for bringing that to our radar, Mas Anies. I think the Meta global team, especially the Data for Good team, is continuously monitoring different health situations around the world. And if, well, I hope not, but if there is an increasing case of hepatitis in Indonesia and other countries, I'm sure they'll turn their attention to this, and also sure that they are open to sharing more relevant data to our stakeholders. But I hope this is not the case, and I hope it doesn't happen, so we can focus on other data that can improve people's health instead.
Yeah. Okay. Yes. Thank you very much. Thank you, Mas Noory, Mbak Dyana, Mas Rino, for joining this very insightful session. And thank you also for all attendees, participants who raised a very interesting question to raise up the discussion. And I would not to summarize this session, but it is a very interesting. We need also to promote the publicly available data through many platforms to be used for either for research, for policy making, and also other aspects to support our people, our population. So I would like to return back this session to Mbak Nadia. Thank you very much for participation for panelists, from panelists and also the attendees. Please, Mbak Nadia.
Thank you very much, Pak Anies, for moderating this very heated session. I very much enjoyed the discussion that we had, and there are many points that were brought up that can be implemented for what we should be doing next and what we can expect from local governments and also other tech companies to be implementing in providing the data, and also how we can use this for public health resilience. Ladies and gentlemen, this marks the end of the webinar of mainstreaming the use of publicly available data in strengthening public health resilience in Indonesia. We would like to thank all the parties that were involved in the success of today's webinar. Thank you to our moderator and all panelists, and also all of our audiences that have joined us today, both through Zoom and YouTube. See you all in the next CSIS webinar. Wassalamualaikum warahmatullahi wabarakatuh. Thank you.
Terima kasih, Mas Anies.
Terima kasih, Mas Noory semuanya. Terima kasih, Mbak Diana.
Anies, Mbak
Pamit
Diana.
semuanya.